I'd like to call out the names of the panelists as I have them here, and in exact manner in which I was given. I'd like to call out Mr. Adeyemi Adebayo, Director Health and Biomedical Sciences, Federal Ministry of Innovation, Science and Technology. Thank you very much. Can we please lead him here warmly? Thank you. I'd like also to follow quickly Mr. Ekenem Isiche, Deputy Director, Policy Advocacy and Communications, Bill and Melinda Gates Foundation, Nigeria. Thank you. Dr. Peter Ameh, Medical Operations Lead, Helium Health. Dr. Moses Alobo, Head of Programs, Science for Africa Foundation and Grand Challenges Africa. Professor Olaoluwa Pheabian Akinwale, Director of Neglected Tropical Disease Research, Nigerian Institute of Medical Research, NIMA. Professor Lateef Sanni, Executive Director and Chief Executive, Nigerian Stored Products Research Institute. Thank you. All right, I'd like to also bring on our moderators this morning. I understand that Chimdindu, Onwudiegwu, partner Dalberg Global Development Advisors is here. Thank you. And of course, the Program Director and Technical Lead of Grand Challenges Nigeria, Professor Folake Samuel.
Good morning again, ladies and gentlemen. It is our pleasure to welcome you to this panel session. And the theme is Driving Innovation for a Sustainable Future for Nigerians. Today, we will be your moderators.
Good morning, everybody. My name is Chimdindu.
And I am Folake Samuel. So as we have heard this morning, innovation, we are here about innovation. And it means creating and applying new ideas, new methods, new technologies to solving our recalcitrant problems. So the objective of this panel session today is to explore and promote innovative strategies and locally relevant solutions that can address Nigeria's critical problems. And to help us to achieve this objective, we have a distinguished member of panel here. We have Mr. Adeyemi Adebayo, Director Health and Biomedical Sciences, Federal Ministry of Innovation, Science and Technology. You're welcome, sir.
Thank you. Good morning, everyone.
We have Mr. Ekenem Isiche, the Deputy Director, Policy Advocacy and Communications in the Bill and Melinda Gates Foundation, Nigeria. You're welcome, sir.
Good morning, and thank you for having me.
And Dr. Ameh is the Medical Operations Lead of Helium Health. You're welcome.
Thank you very much. Good morning, everybody.
We also have with us Dr. Moses Alobo, the Head of Programs, Science for Africa Foundation and the Grand Challenges Africa. Welcome.
Thank you and good morning.
Professor Olaoluwa Pheabian Akinwale is the Director of Neglected Tropical Disease Research at the Nigerian Institute of Medical Research. You're welcome, ma.
Thank you very much. Good
and
morning.
last but not the least is Professor Lateef Sanni, Executive Director and CEO of the Nigerian Stored Products and Research Institute, NISPRI. Welcome, sir.
Thank you very much. Good morning, all.
Great. Thank you, everyone, and thank you to the panelists. So the way this is going to run is that there's going to be 2 questions to each panelist. So first round of questions will go, and then second round of questions. We are allocating 3 minutes to each question. So please, we would like us to keep to time, and we'll try to ensure that we do that. The questions are going to be rotated alternately by Professor Samuel and I. And if there are any clarifications when we ask the questions, please feel free to ask. Thank you.
Thank you very much, Chimdi. So our very first question goes to Dr. Peter Ameh from Helium Health. Helium Health has been a very key player in leveraging technology to address critical health challenges in Nigeria. And notably, Helium Health received a grant from Grant Challenges a while ago to develop a digital antenatal risk stratification tool. So today we're going to ask him a question about that. Dr. Ameh, following your experience with projects like this, what specific strategies can ensure the scalability of telemedicine and digital health in Nigeria, as well as low-cost diagnostics that can help us to address maternal and child health in Nigeria?
Thank you very much. And again, thank you for the opportunity of being here. In trying to address or trying to build technology, again, I'll be referencing the antenatal risk stratification project that we did. We always try to look at, when you're bringing technological solutions, especially to low-resource regions, we always try to see how we could build technology with the consumers in mind, or people that are going to use it. It's always best that whatever you build has to be customer-centric, yes? And this is very important. Looking at the antenatal risk stratification, I call it ARS project that we did, we're looking at building a tool that women could use to check if their pregnancy is at any risk, and then they will be able to get recommendations, right? So using that to see how we can leverage technology and scale, the first thing was to make sure that whatever we build, you have to build with your stakeholders. So having stakeholder engagement is actually very important. So we needed to build first a questionnaire that we could leverage those questions from, and also build the technology that it will be hosted upon. And in trying to do that, we made sure that we carried our stakeholders along. Stakeholders being first the providers of service, and also those who actually will be using the tool itself. So in trying to create the questionnaires, we try to make sure that we use sought inputs from health professionals, all the way from those at the lower levels through to those at the ministry level, to make sure that whatever you're building, apart from the fact that it will be standard, it's also localized for the regions that you're in. So you don't build something that doesn't follow with what the practice is in the region that you are located. You have always want to build things that are relatable, right? They are standard, but they are also relatable in the regions that you are in. Secondly, looking at the people that you're going to build for, if you're building technology for any disease condition, trying to build something to sort one issue or the other, you have to look at the people who are going to use it, because it's technology-based. We built this technology for those in underserved regions, and for us to even build, what technology are we going to use? Where are we going to host these questions? We had to literally look at the people that we're building for and see exactly what kind of technology they're exposed to, and what would best fit exactly what we build. So there might be no point in building something really huge that they can't use in the community that you are going to put it in. So you need to build something that fits the community they're in, looking at what kind of technologies they have, what would they be able to use, and it has to be very user-friendly. Mm-hmm. So you build things that people can actually relate to. Secondly, you don't just build technology and let it be. There has to be capacity building. You need to literally train those who would be using technology directly and indirectly too, so the health professionals. So if you're doing any technological solution, you have to maybe to train people who would use it, or try to make sure that it's easier for them to use, so they'll be able to use it and then continue using it. I think thirdly, and another important point would be that in trying to build solutions for the community, you need to find a way of making the community accept your solution. So in that case, you need community entry, right? You need to partner with the heads of the community, because they will look at it and be like, why should I use this technology when I could go about what I was doing before? But to bring that impact, you need to leverage on the community to actually, get to the people that at the ground level. And then fourth, which the last point I'll bring here is, when you build technology, you have to be able to take feedback a lot. You want to scale technology, you want people to keep using it, you want to see how exactly they're experiencing with the technology. So you don't build and dump and go. You literally want to build, and at every point, take feedback, look at what data you're having, what errors might be having or not, and use it to iterate with the technology that you have to make sure you have like different loops or versions of that technology for leading to the best version that you would have. With this, you should be able to actually build good technology for the community and scale it in the way that they have it and they use it.
Thank you very much for those wonderful points. Strategies to ensure that we can scale telemedicine. You've talked about co-creation, consumer-centric creation, end-user feedback, and so many other points. Thank you very much, Peter. We'll come back to you, but right now, ask Chimdi to continue.
Thank you, Professor Samuel. Mr. Ekanem, we know the Gates Foundation has led a lot of work in maternal and child health in the country. How do we ensure that funding and resources are directed at the most impactful and innovative solutions, particularly, like he mentioned, in underserved regions where we continue to have systemic barriers?
Thank you for the question. I think the first thing I'll say is investing in mothers and children is a development priority for us. And the fact is that the lives of mothers and children is also a national development issue. What we have seen is that maternal and newborn child innovations can save lives up to 260,000 people per year. And if you also invest $1 in maternal and newborn child innovations, you will get about $87 of social benefits. So in other words, there's a math to the work that we do even at the foundation. The other thing I'll also add is that the Bill and Melinda Gates Foundation has also been part of the Grand Challenges program from inception. I think to date, they have done about 4,000 investments through the Grand Challenge program and about 85 investments in Nigeria in particular. And now going down to your question, so what we have done is to work with the Federal Ministry of Health and the National Primary Healthcare Development Agency to see how can we map areas that have the highest burden of maternal and newborn, mortality rates, so MMR rates. So the first thing we did was to map that with them. And so at the moment, we currently have an assessment that shows the hardest hit areas with the highest level of maternal mortality rates. And then, so what are we doing around that? We decided to come up with 3 solutions to see how can we begin to think about addressing this issue. The first one was to look at what we call the E-Motive. The E-Motive is a program I'm trying to roll out through the PPH, postpartum hemorrhage. Postpartum hemorrhage is the highest, is the single responsible source of why there's a high maternal mortality rate in Nigeria. And so the E-Motive is a compendium of different solutions put together to see how can you solve that. The second solution we also are looking to scale and we're currently working on is around MMS, which is the multiple micronutrient supplements, which is given to a mother, a pregnant mother. So it looks out for the nutritional status of the mother and the child. By doing this also, you also avoid some level of deaths that could occur due to postpartum hemorrhage. And then the third one is really around a program called REACH, which is Resilience Through Azithromycin for Children. And what we have figured out is that this strategy has been quite effective in prolonging lives of children, especially under 5 children. And then the other thing I wanted to add is the fact that we've been working with the Federal Ministry of Health, like I mentioned earlier on, but also the Office of the Vice President and also some of the, under the Federal Ministry of Health, the Nutrition Department, and the Office of the Vice President. But we're working on a program called, and based on the recent consumption and micronutrient states survey. I had to look at my notes to make sure I could pronounce it correctly. And so the whole idea is to look at what programs are actually targeted towards addressing the hardest areas that have issues around malnutrition. So how effective are those programs? So we roll out a lot of programs, as you know, generally, but the question is how effective are those programs? So that's what we have been doing over at the Gates Foundation.
That's really helpful. I think it's great to hear how there is the importance of targeted solutions based on mapping of the need areas and also multi-stakeholder collaboration to ensure that there is no fragmentation of solutions as well. Professor Akinwale, we know that the Nigerian Institute for Medical Research has done a lot of work in molecular diagnostics, as well as disease surveillance to be able to combat infectious diseases. It would be great if you could share some of your key successes and how these outcomes can be leveraged further to ensure that we have innovative and impactful solutions in the space.
Thank you very much. I'm very happy to represent the Apex Medical Research Institute in the country, the Nigerian Institute of Medical Research, on this panel. We know that managing infection in Nigeria is faced with several challenges, one of which is early detection of infection. And many people, especially in hard-to-reach communities, remote areas, suffer from infections that are not detected, and many of them die. So the Nigerian Institute of Medical Research tried to bridge the gap of this early detection of infection, and we came up with many innovations. During the COVID pandemic, the Institute came up with 2 assays that helped the country in detecting and controlling the pandemic. The first one is the SARS-CoV-2 isothermal molecular assay, SIMA. And the second one is SARS-CoV-2 detection assay, which is the SCODA, which we deployed and in collaboration with the Nigerian Center for Disease Control and Prevention, we're able to use these assays to manage the pandemic successfully. And the Nigerian Institute of Medical Research is very proud to play this role. And then we also came up with some innovative kits in detecting diseases that are of public health importance, the viral infections like yellow fever, Lassa fever, monkeypox, and hepatitis B. We have these kits, we launched them, and they are very affordable, cheaper than the foreign kits, and have the same sensitivity and specificity with these kits. Currently, we are developing cholera detection kits because we know that a lot of our people are suffering and dying from this infection. And these kits, what our innovators are trying to do is to make sure that these kits, with these kits, we don't need any expertise or specialized equipment, and they can be deployed to rural areas, rural health centers, with little or no supervision. So the Nigerian Institute of Medical Research has really taken a front row in trying to bridge this gap of early detection of infectious diseases and to save as many people as possible from dying from this infection. Thank you.
Great. Really happy to hear about the affordability aspect of this, as that's critical.
Yeah, they are quite affordable, like I told you. They are cheaper than foreign counterparts, and they are equally sensitive and specific. They are easily accessible. We are in Lagos. We have other stations in Borno State, Niger State, Delta. So we are everywhere. So you don't need to order and wait for months like we were doing before to wait for the foreign kits. So they are affordable and accessible, specific and sensitive.
That's great.
Thank you.
Very interesting discussions from homegrown local solutions, innovations, and how to make strategies work to issues around funding of innovative projects in Nigeria. And now I would like to ask Dr. Moses Alobo a question. Given your extensive experience in Science for Africa, funding grand challenges projects across the African context, we would like to hear your thoughts about what the high impact investment areas are, which are the most promising for maternal and child health challenges in Nigeria, given the array of different contexts in African countries.
Yeah, thank you so much, Professor, and it is our honor and pleasure to, come and support this particular initiative. We are from Science for Africa Foundation, Grand Challenges Africa, and our group has been doing quite a bit of work on the continent, for the last 10 years. But I'll focus on a few things that we've done recently that we think can be able to contribute here. We did a research prioritization exercise for maternal and neonatal child health that the report came out in 2021. And this year again, we did convene a funders forum where we brought together all the funders in maternal and neonatal child health on the African continent, and then had a discussion around if we are to go ahead and have the best buys, investments that will give us the highest return on investment to reduce the neonatal and maternal mortality ratios, what could those potentially be? And we identified 4 grand challenge areas that we think that investments would actually get us there. Of course, better care during pregnancy, better care during birth, and then better postnatal care for women and newborns, and then of course, for the sick newborns, better hospital care would be absolutely important. And then these are things, of course, that have been done for a very long time. But what we are currently insisting is integration of new methodologies into this piece of work. So, for example, integrating artificial intelligence, integrating genomics, integrating pathogen genomics and also human genomics, data sciences, and also their translational aspects. The interesting thing is that the reduction in the rate of neonatal mortality and also maternal mortality has decelerated. And it's as if we've now reached a plateau over the last 10 years. And questions are now being asked, what is it that we potentially need to do if we are to move forward and make sure that we are hitting the SDG targets? So we do recognize that there are some knowledge gaps. We do have knowledge gaps as a global community, and I'm not just talking about Africa alone, in the understanding of stillbirths, in the understanding of preeclampsia, for example. At the same time, the innovations that we usually put together, they face a wall. They face a wall of scalability and transitioning to scale. We think that if we do these 2 particular areas and then make sure that we bring in other disciplines into innovations building, then we should be at a better place. So as I close this particular question, I'd just like to add that we had a look at the data that was coming out of West Africa, and I'd just like to mention a few things, things that came or bubbled to the top from the 900 investigators that we sampled. There's a need to develop innovations that assist mothers in recognizing the danger signs in sick newborns, so that our mothers, our fathers, and any caregivers of children do not stay at home with sick children. And then, of course, even within the hospitals, have algorithms that can be able to risk stratify mothers during antenatal clinics. Maternal nutrition has been mentioned by my colleague from the Gates Foundation. But at the same time, we do need to develop best practices for preterm care. There's a lot more on that particular list. It's available, but we are looking forward to working with Grand Challenges Nigeria in making sure that the request for proposal that will be unveiled today is actually responding to the needs of Nigeria in the area of maternal and neonatal child health.
Thank you. Indeed, what you have shared with us will go a long way to shape some of the innovations that we will be looking at here in Nigeria through the Grand Challenges. You've really given us a snapshot of your wide experience in the area of maternal and child health innovations across Africa, and particularly West Africa. Thank you for that. I'll quickly go to Mr. Adebayo, and I want to express our profound gratitude to the Federal Ministry of Innovation, Science and Technology for immediately aligning with the Grand Challenges vision in Nigeria. So I know you've been championing a lot of science and technology innovations in the country for some time. I would like to ask you, what are those key technological advancements that you're currently working on? And perhaps you can give us some idea on how to scale these up at the national level. Thank you.
Thank you very much for the question. And we are, the Ministry of Innovation, Science and Tech, very glad to be here and to continue working together with all the everyone. For the Ministry of Innovation, Science and Tech, just like you said, in Nigeria, over time we've been working. We've championed some innovation, especially that can address child and maternal health. Okay, in Nigeria, especially from the perspective of innovators, and also giving opportunity for indigenous innovation that can, address some of these challenges locally. Sometimes it's reasonable when you want to have a solution that is domain specific, and sometimes you want to make sure that whatever solution that you're providing or you are trying to create, it tries to think about the economy of the nation. So to that effect, Ministry of Innovation, Science and Tech, not too long ago, we've been able to develop and establish a telemedicine platform. This actually referring to an re-engineering of a mobile clinic that leverage telemedicine, and this was done by the role of an agency of the ministry, that is a National Agency for Space Research and Development. And this device is able to solve a problem of bringing hospital to the unreached. So, but we're not doing this particularly alone. This is done in collaboration with Federal Ministry of Health, and these buses that was actually created have been deployed and through the the services, hospital services of the Federal Ministry of Health and Social Development. So that is one. But when we're talking of innovation, we're always talking of something that is inclusive and that can be scaled, just scalable. We know that the kind of project that was done, sometimes it could be a tall order for many governments. And for the government to be able to replicate that, it might take some time, a bit of a budget. So apart from having that deployed, the ministry also explore innovation from innovators. Now, we've been in collaboration with other, non-governmental agencies, like this Social Initiative for Social Innovation for Health Initiative, CAI. And through the activity of this collaboration, we'll be able to identify Nigerians, especially, I like to say indigenous innovation, that have solutions, apps, and that have been able to scale down this technology, telemedicine technology, to something that could be used almost informally and without necessarily having so much capacity to deploy it. So we've been able to identify two, particularly that the ministry is working on, and especially a video teleconferencing, device where the ministry is looking up to scale, maybe in the nearest future. Okay, so let me just go ahead to answer the aspect of what are the opportunities there to scale this innovation that we're able to do. Government is on its own, particularly has to play the role of putting the right, incentives for innovators to be able to, scale or to be able to make use of their innovation, and we can use their innovation for national, development. So the areas that we're looking is when these innovators and their simple innovation, government looking for opportunities like we're going to have now with Grand Challenge, to be able to see how we can scale, the solutions that they have provided, and see how this can be deployed in high levels to solve national health problems. But definitely, the innovation is not only on health, other areas, many other development areas. Thank you.
Thank you very much, Mr. Adebayo, Adeyemi. Without doubt, we are properly positioned to be anchored within the Federal Ministry of Science and Technology.
Absolutely.
Thank you for sharing the collaborative nature of your ministry with us in terms of innovative ideas and in terms of scaling. I think, Chimdi, you're ready for me?
Yes. Professor Sanni, we all know about the current food insecurity and malnutrition issues within the country, but we also know that your organization is working to promote sustainable agricultural practices. How can the sustainable practices be used to achieve dietary diversity and also address food insecurity issues, as well as ensure that there are practical and scalable models that can be widely adopted across the country?
All right, thank you very much for this opportunity. We all know that Nigeria is an agrarian community, and we have natural and abundant resources. Number one, issues in sustainable dietary practices is for us to strengthen our crop, livestock, and forest diversification. When we were young, most of the functional foods that assisted some of us, including my mama here, are no more. And this is very critical that I want us to look at. The avocados of this world, the yeye of this world, agbaluma, these are some of the diversifications that we need to face in this challenge program. The second point is nutrient-dense foods from locally available commodities. Locally available commodities. We call them underutilized crops. People do not know the power of Bambara nut, and that's the second point that we have looked at. We started the issue of school feeding program, but the way the school feeding program need to be restructured to be able to accommodate some of the things that were given to us to grow. If you want nutrient strong community, you must eat what you are producing. As an institute, Nigerian Stock Product Research Institute was established in 1948 by the British government and served the East Coast, Ghana, Togo, and over the years, the UK government strengthened that institute such that it is not possible that you will export any aflatoxin contaminated groundnut out of Nigeria or Ghana or Togo. Talk less that EU is banning our cowpea. Whereas our institute has technology that solves those problems. Non-chemical. No side effect. His Excellency, the Executive Governor of Borno State, recently ordered for 1,000 metric drums from my institute now. We have delivered them. The drum treated is less than 100,000 naira. In fact, it's less than 80,000 naira. People are not aware. 2, the Sasakawa African Association, strengthening communities in the north, now in Kano, for instance, order for 210 of their emetic drone to replace the Purdue Pigs bags that can easily be damaged after use. International Institute of Food Policy Research, IFPRI, in Washington, now commissioned my institute. We have installed 10 parabolic dryers in Kano for rural vegetable producers that will be able to produce nutrient-retained, dried horticultures for the infants. So, the point I'm saying is that, number one, we need to promote and re-engineer the diversification of our crop, livestock, and forestry. Number 2,